Hi, my name is Heidi Panasuk, and I am doing a full physical assessment on Renee here. We're going to begin by the integumentary system. I'll assess the skin, her skin. She'll be in a gown, but I'll assess her skin and her mucous membranes. The skin, the general appearance is overall healthy. You can check the skin turgor by her wrist here, or also up by her neck. You want to check if they feel cold, if they feel hot. She feels fine. You just want to check also her venous if it looks abnormal. If she looks cyanotic, that could indicate liver or renal. You can also check for any bleeding or any lesions she has on her body, or any bruises. And if she's been in the hospital lately, she's probably had a lot of those. Anywhere pattern, and you would also assess if there's any drainage. For the older person or the person who has a compromised range of motion, rub it all. They have a decube on their back or on their bottom. You don't want to rub any of the bony prominences or any for pitting or non-pitting edema in her body. I would check her nails. She's got a gorgeous ring on, by the way. I love it. I would check her nails for the capillary refill, which is 3 seconds or less is the norm. You check it. It could mean a vitamin deficiency or just you're malnourished. I would check Renee's hair. She's got gorgeous hair too, by the way. I'm jealous. You check any lesions or for make sure that everything's evenly distributed. You don't want any bulges or anything. You're good. You're normal there. Theory. Anyway, musculoskeletal system. With this, we would check her range of motion. Okay, stop. Now I'm going to assess Renee's musculoskeletal system. Right now, we'll check her range of motion. And she keeps laughing. That's all right, we're going to keep going. This is hard. So I would check her range of motion to see that her limbs, she can move them all. You can check they're flexible, which is okay. You do, for the motion, you do for strength and equality. I would also see if she can do it on her own without me helping her. I would assess, while I'm doing this, for any muscle pain, any cramps, or any spasms that she would be having. Have you had any problems with that? No? Okay. I would assess for joint or pain stiffness, for any abnormalities, to see if there's any, I'd be feeling for, this would be trauma, degenerative joint disease. I would also assess Renee's ability to be able to sit, stand, or walk, and her posture and gait. And I would assess this also if she's coming into the room and sitting down or while we're talking. I would also have her stand up and check her spinal curvature. An abnormal spinal curvature, you could have kyphosis or lordosis. I would check, you can do hand grasps. You make sure they're the same on both, which is a decrease in muscle size. You could also note tremors if she was having any, and flaccidity, which is weakness of your muscles. Now I'm going on to the central nervous system. I would check Renee's level of consciousness. I would ask her time, place, and person. So what's the date today?
Valentine's Day.
Oh. What's your full name?
Her name is Shawi.
And where are we at right now, hypothetically?
The hospital.
Okay, so she's good. She's pretty much with it. I would assess her comfort level and presence of pain, and I would also, for her mental status, do a mini mental that goes over different aspects of your mental awareness. When I would assess her pain, I would ask her if she's having pain in any areas. Are you having any pain? And if she was, I would ask where it was, how long she's been experiencing the pain, the type of pain, and if she's had any. I would assess her sensory functions, such as her pupils. I would know how to turn this on. And the battery's going out, so it's not my fault. There you go. It's not the battery, it's me. Operator error. So I would check to see that her pupils, and they are. After that, I could also assess and make sure that her pupils are equal and they are reactive to the light. Quit, Kevin. Okay, stop. I would also assess Renee's hearing by either whispering away from her and seeing if she could hear what I hear. So you ready? I would also use a tuning fork. You can ding it on a in and out. You can. There are other tests you can do. I would assess for skin tingling. Have you had any tingling sensations at all? No. Numbness or burning at all? By doing the hand grips. And assess your foot strength. You can plantar flex. Okay, I would just have you go normal.
Sorry.
That's all right. And plantar flex against my feet or my hands. And then go back. And you just want to make sure they're of equal symmetry. They have the you know what I'm talking about. They're both equal when you're good patient. Okay. I would also assess for any histories of seizures or tremors. Have you had any?
I haven't.
You haven't. Well, good.
I fainted once, but that's it.
But that's it, and that was all taken care of. You had an assessment on it. Okay. Well, now I'm going to move on to cardiovascular. Your cardiovascular pulse. And you like to do light touch first. You can always feel better that way. I assess the rate, rhythm, and quality. She has a very good, strong pulse. What else I would do? I would assess the blood pressure with the blood pressure cuff, the sphygmomanometer, and I would assess for, on both sides, on an initial assessment, to make sure we have a baseline for when she keeps coming in. A normal blood pressure is about like 120 over 70 or 80. I would note for any postural or orthostatic hypotension. I could also check for descendant neck veins. You have fluid volume excess, perhaps. Also, like I said again, assess the body temperature of the patient. I would auscultate her heart sounds with the stethoscope, which I will, 8/5 intercostal space. And that's also your PMI and what you would assess for if you were going to give meds, a heart med. Listen to her heart for, I would listen for the S1, S2, which is the love dove sound, and I would also listen for any heart murmurs or any extra heart sounds that may be present at this time. I would dipstick, whatchamajigger, and go ah. You didn't do the ah. There you go. You look good.
Thanks.
I would assess for any angioedema or stomatitis, which is inflammation of the mouth. I would assess her skin color, and I would also check for flushing. Again, what I'll be doing is palpating the skin for the temperature, which we've already done, and like it was said before, you can incorporate many of the things that you assessed for earlier. You can do it all at once. You can notice these all at once. I would palpate the extremities for edema, bleeding on Renee, such as nosebleeds, incisional bleeds, bruising, or any hematomas that may be present. Okay, now we're going to the respiratory system. I would just assess the general appearance of your respirations, which they have to do to assess the rate, rhythm, and the quality of your respirations. The normal respiration range is between 12 and 20 with 18, give or take, breaths per minute. I would check her using her accessory muscles to see, if for the size of, check for any spinal deformities, which I would have done previously in the musculoskeletal, which would be very, very bad at coming to collapsed lung. If you feel any subcu emphysema, which is like Rice Krispies underneath your skin, or any respiratory excursions, that would be patient. You couldn't do this; they wouldn't be able to handle sitting up like this position. You auscultate the chest. I would be listening. I won't put it in my ears, but I'd be all the way down her lungs, and I'd be checking both. You are in trouble. I'd be checking for the quality, the type of breath sounds. Presence of adventitious breathing. Could be hearing in her lungs right now, which is good. But if she was, I'd be assessing how often she's coughing, and if there's any sputum with it, you want to. If she was having complaints of shortness of breath for dyspnea, which is just difficulty breathing, and and also for the color, this determine the best position for patients. Like Renee is fine now. She's a healthy individual. Time lying down. If you're down.
I don't.
Well, that's good. If you did smoke, I would ask her how many packs a day she smokes and how long she's had smoke for. I would also review the chart to see if she's had any history of respiration, if there are any. Next, we'd move on to the GI system. I won't pull her shirt up, but I would inspect for the size, the color, appearance, see if she's distended or not, any venous patterns. I would auscultate in all 4 quadrants for bowel sounds for 30 seconds for each one to listen for bowel quadrants. And if you don't hear bowel sounds right away, you want to listen for 1 to 5 minutes in that area until you hopefully do. I would want to palpate to detect it's hard. Right? Is this hurting you?
It isn't.
Okay. If there's any presence of masses or ascites. Have you been vomiting or been nauseous at all?
I have.
No? If you had been, I would want to know on the amount eaten, tolerance issues. For some people that might need more fiber, they might need more stuff like that. Taste or are there?
Yep.
Okay. Any weight gain or loss suddenly
No.
at all? No? Okay.
Not suddenly.
No. Okay. You're pretty good. You sure? Okay. If Renee had an colostomy or ileostomy, I would check to see if they're check the adequacy of the equipment, and I would review her chart again for any diagnostic tests and if she's had any previous GI problems. Next, we move on to the urinary system. I would maybe at this point, I mean, you could give a urine sample. Is there any scent of your urine?
No.
Is there any odor?
Well, no.
No.
I was like.
Urine at all? No? Okay. I would palpate her bladder for distension if everything felt normal. I would inspect, if she had a urostomy, I would inspect the stoma. I would also check your chart to assess any drugs that would affect your urinary tract and check any abnormal lab values. And then moving on to the reproductive system, it just varies with each level of activity they can endure. I would assess for your sexual maturation. I would inspect, but I'm not going to, Renee's breasts, and check for any masses, the skin, the size, make sure they're symmetrical. I would ask Renee, do you know how to do a monthly self-breast exam? Yes. And do you do them?
Yes.
And do you know that it's best to do them right after your period?
Yes.
I would do any live births. I would determine if there were the results of her last pap smear and gynecological screening, and just review sexual activity. You know, like is there pain or discomfort? Or do you have any feelings or concerns? Do you like the numbers of partners and those types of things? I would also assess for the presence of vaginal or penile discharge. I would also, are you on birth control?
No.
And at this time I could incorporate teaching and education on the effects of birth control, what they do and don't, just assess. Finally, your psychosocial system. Final and last one. Do you have any at this point in time? Stress or anxiety?
No.
No, not a big one coming out of school. I agree. Oh my gosh, nursing 260. But I'm gonna ask about her support systems. Do you have support systems at home, school, friends, those kinds of things?
Yes.
And she does, so she's good there. I would ask if there's any. Do you have any history of abuse, physical, and ask if do you have any alcohol or drug abuse?
I don't.
I didn't think you did. And I would also assess the patient for learning needs with regards to health concerns. And with all of this, you want to document. You have to you want to document the information, anything that you observe with your patient. You definitely want to chart your subjective data, objective data, and also your nursing diagnosis, and your complete physical assessment on the patient, and your assessment, and document any referrals that you had. So you're healthy. Thanks, Renee.
Thank you so
Bye.
much.
My name is Cuka, and this is my physical assessment for Nursing 260. First system that we'll assess the skin and any mucous membrane. We will assess turgor, so you can do that by pinching the skin, and she seems to be healthy and full of fluid, so she's good. My name is Cuka, and this is my full physical assessment for Nursing 260. We're going to go over all the different systems of the body, and first we're going to start with the integumentary. So So first I'll assess the skin and mucous membranes for integrity, make sure there's no cut. I'll assess for turgor, general appearance and temperature. She seems to be very healthy, there's no problems, and she's not cold or clammy. She is pretty warm. Color and venous pattern, she tans, she's told skin, and there's no varicose veins, nothing like that. She doesn't have any dryness or pruritus, bruises, anything like that. We would want to note if she's cyanotic, if she has any jaundice, pallor, for wounds or healing or drainage. Just make sure that her skin is intact. That's the main thing that we're looking at. Don't want to have any risk for infections or anything since she's in the hospital. I'm going to assess temperature, so I'll palpate around her ankles just to make sure that there's no swelling, and if there is pitting, I want to note the grade and if it's pitting or non-pitting. Any altered temperature, make sure she's not cold or clammy. Nails, I'm going to look at her, a sign of poor nutrition. Her hair and scalp, I'll look at her head, just make sure there's no bumps or bruises that she might not see. Make sure that her hair isn't, if she's been in the hospital for a while, she can be laying down. Assess for movement, show her, I can kind of demonstrate, and that way I can see how she moves her arm, and then let her kind of repeat the motion by herself. That way I can see how she does it. I want to note motion, I want to note the strength and the equality. I want to examine for bilateral symmetry, and I'll have her grab my hands and just pull, making sure she's pulling evenly on both sides. I want to ask her about any muscle pain. You having any muscle pain? Any cramps, spasms, any joint pain or stiffness?
Nope.
Bones for her knees or the trochanter, any areas, any neurological diseases, any trauma that she might have had. Have you had any broken bones?
Nope.
Nothing like that? Okay. And as she walked in the room and as we were preparing for the whole physical, I would have assessed her gait, her posture, and I could have watched as she was walking in the room for her spinal curve, assessing for kyphosis or lordosis. And I just want to kind of look at atrophy, so if she has smaller than normal muscle size, any tremors, if she's got any involuntary movement, or flaccidity, which is weakness of muscles. And that was all something that I could have observed. I'll assess her level of consciousness by asking, what's your name?
Heidi Pamela.
Okay, and do you know what year it is?
2006.
And do you know where we're at?
We are at the clinic.
Okay. And through conversation, through whether she's appropriately dressed, anything like that, or you could use the mini mental health exam, and that is kind of a more standard procedure. So we'll assess for comfort or presence of pain. Are you having any pain, any numbness, tingling, burning sensations anywhere? If she does have any pain, we'd want to note location for the pain, if she's taking any medications for it, if whatever that is. So then the next thing we'll assess in the central nervous system is her sensory functions. So we want to first assess her pupils. So yep, they seem to dilate. So she's good there. And then we can assess her hearing by either whispering out of her line of sight or using the tuning fork. And so I'll use that. And we kind of can tell, can you hear that?
Mm-hmm.
And then, that thing keeps going, huh? So yeah, she's got good hearing. She could probably hear it from across the room. Next we'll assess her motor function. We can assess her hand grips. And mainly this is just to assess that she's got control over her motor functions. So we'll assess the hand grips and then yep, and so we know that she's got control over all her musculature. And then we'd want to assess by asking her if there's a presence or any history of seizures or tremors. Do you have any problems with that? Good. So the next thing we can do is skip system. The first thing that we want to do is, if I could have your hand, we're going to assess her pulse. And I'll just have her kind of rest her hand and using light pressure, just assess her pulse. And yep, you can get it, feel quality deficit if possible. The next thing you want to do is assess her blood pressure. Since we all know how to do that, we would just want to note equality on the thing that we'd ask her. Do you feel dizzy anytime you stand up?
Nope.
Does that cause you any problems? All right. Then we'd look at her neck veins, noting if they're distended or anything like that. Looks fine. She's not hypo or hypervolemic. The next thing we could do with the patient, what you want to do. You want to do it on the opposite side if you're doing it axillary, or you could do it by mouth, either way. And then the next thing we would do is auscultate heart sounds. And the main thing you want to do, which is the lub dub, or any murmurs or extra heart sounds. And so we'll do that. And you can hear. And you would assess an apical pulse for about 30 seconds, or you could assess for a full minute if you wanted to. System. We just want to check her mucous membrane. Go ahead and make sure everything's okay. Seems to be fine. And we want to note on her skin any cyanosis, pallor system. System, palpate the skin for temperature, palpate extremities for edema, pitting or non-pitting. We inspected the nail beds for nutrition, and capillary refill is very important in the cardiovascular system. Pressing the nail down and making sure that it refills within 3 seconds. And then we want to ask about any nosebleeds, any incisions, any bruising, hematoma.
Nope.
Nope. So, moving on, we're going to go to the respiratory system. What we want to do is assess the general appearance and her adequacy of respirations. We can be observing that throughout the assessment. We want in 20. And we want to assess the rhythm and quality of the respirations, chest, thorax, shape of thorax, and the presence of any spinal deformities. It sounds like Rice Krispies, then that's a bad thing. We need to get that looked into further. The next thing we would do, I'll have you sit up. I'm going to listen to your lung sounds. First things, and I'm not going to put these in my ear, kind of observe how her chest moves in her front and back. And so you could start up here, and normal breathing. Listen for any, if you can hear it, the quality, types of breath sounds, such as wheezes or crackles, bronchi, whatever. And on the back, you would want to just noting all the lobes of the lung and making sure that there's no fluid. Usually if there's fluid buildup, it would be in the lower lobes of the lung. Then we would assess for coughing, if she has any coughing problems, or you coughing up anything. All right. And how often she coughs, if she had one, you can sit back if you want. The duration, when with a productive cough, you want to get color, consistency in the mouth, and sometimes you could get labs from that, cultures. Assess for complaints of shortness of breath, any dyspnea, orthopnea, anything like that. Mucous membranes and skin for color. It's an indicator of O2 perfusion, and everything looks fine. Her ears are red. She's got. And we want to determine the best position for the patient for comfort. Then we want, well, good, because if you did, you're going to kill yourself. And then we want to ask if they do smoke, how many packs a day, and how long the patient smoked. Or if they were a previous smoker, we want to know how long they haven't been smoking and what they used to smoke, all that. And then we would always review the chart, because that would be in the patient's chart system. We're going to inspect the appearance of her abdomen, if it's distended, and the side. We won't have Heidi lift her shirt. We just want to make sure it's not abnormally bulging. And the next thing we'll do is auscultate for quadrants, starting with the lower right. And you want to listen for up to a minute to make sure that you can hear something. And then you would move around in a clockwise position. And then you just return back and make sure you hear everything. And you would palpate whether it's soft or there's any hardness, distended, presence of mass or ascites. And then you would ask the patient about nausea or vomiting. Do you have any problems with that?
None of it. No.
Okay. And if they did have any problems with it, you would ask how much, how often, the appearance of it, any abnormalities with that. Then you would assess the diet. You know, are you living off McDonald's?
No.
Or, okay. And you want to do any dietary tolerance issues such as lactose intolerance, anything like that, irritable bowel syndrome, anything like that. You would assess for any changes in appetite, taste, or ability to swallow.
No.
Having any problems with that?
No.
Okay. And then any recent changes in weight. And you would assess for the usual pattern of bowel movements and the passage of gas.
I'm good there.
Gas is normal. Then you would inspect, if the patient has one, you would inspect for an ileostomy or colostomy. You would assess the stoma, the condition of the stoma and the skin of the equipment. And of course, you always review the chart to assess the drugs that affect the gene. Moving on. to the urinary system. We're going to assess the usual pattern of urinary output. If you notice any don't go that much, cloudy, anything like that?
Nope,
Any smell that's unusual?
not so much.
Okay. Do you have any like frequency, urgency, hesitation, anything like that? Okay. And have you had a history of urinary tract? Get the bladder for distension. If it's large, use a bladder scanner to assess, the amount that's in there. If they had a urostomy, you could inspect that. And any other appliances. Look at the stoma, function, condition, and adequacy of the equipment. And then you would review the chart again to assess any drugs that affect the urinary system. Then, since I'm a man and our patient's a woman, usually the reproductive system, it's more to talk to a female patient, but the things that they would assess would be sexual maturation, any tenderness, changes in breast appearance or lumps, inspect the breast for symmetry, size, shape, contour. We're starting over on that one. Pause. So, we're going to assess the reproductive system. We'll assess for sexual maturation, determine if the patient has any pain, inspect the breast for symmetry, size, shape. The female nurse would assess, palpate the breast for skin temperature, elasticity, tenderness, all that. And you could assess the patient's knowledge of a self-breast exam and make sure she knows how to do that because it's menstruation, age of onset, and date of last. Review the obstetrical history with regard to pregnancy, abortion, and live births. Then you would go over results of. Then you would review feelings about that. Then you would assess patient's need. System. We'd want to assess the patient's need for contraceptive and education. Okay, for a while, and you know all about it.
I probably have.
Okay. Wait.
Okay.
But and then you want to assess the patient's need for education and treatment related to STDs. And you'd want to review the chart to assess any drugs that affect the reproductive system, any side effects like that. Any regards to her feelings about her health or any concerns that she might have. Do you have any concerns?
I don't.
Okay. You want to assess, have you been anxious lately? Any depression? Any mood changes? No? Do you have a support system in town?
I do.
Family, friends? Okay. And any alterations in lifestyle related to altered health status? Is there a history of abuse, physical, coping strategies for stress?
Yoga.
Okay, that's good. Yoga, Pilates, talking, going to church, whatever you need to do. You would, with regard to her health concerns, for the assessment, want to make sure I document everything that we talked about, any information obtained in the physical assessment and with the interview with Heidi. Objective data records specific plans and goals related to problems found, including any referrals that you made. And that is it for the assessment. Hope you had a good time, because we all did here.